Hey everyone, this is Dr. Medicine RX, and in today's video we'll be discussing about hypomelanosis of eye tone. So it is a neurocutaneous syndrome and it is the third most common type of neurocutaneous disorder following neurofibromatosis 1 and tuberous sclerosis, and there is a slight female preponderance. Coming to etiopathogenesis, it is an autosomal dominant disorder which is associated with pigmentary mosaicism, and the basic chromosomal aberrations that are involved are yet to be detected, but various types have been reported. On the whole, there is going to be reduction in the number of melanocytes as well as melanosomes. Coming to clinical features, we've got cutaneous manifestations, neurological manifestations, ocular manifestations, and musculoskeletal defects. So in cutaneous manifestations, we see them at birth and may also appear many years after birth, and they usually fade with age. The characteristic feature is that these hypomelanotic lesions, they appear along the lines of Blaschko, and they are asymmetrical, but they involve both sides. They appear as bizarre holes and streaks of hypomelanosis and give a marble-like appearance. And we've also got other features such as kephaloid spots, nevus of Ota, cutis marmorata, angiomatous nevi, morphia, and hypohidrosis of hypopigmented areas. Along with that, they can also be associated ectodermal defects, and they can involve hair and nail and produce various abnormalities. Coming to neurological manifestations, seizures, mental retardation, language disabilities, as well as motor dysfunction are seen. And ocular features, they present as ptosis, symblepharon, nystagmus, strabismus, cataract, myopia, and corneal opacity. Coming to skeletal defects, there is going to be short stature and growth retardation. Lateral bending of spine, that is scoliosis, is seen. Syndactyly, that is fusion of digits, can be present. Polydactyly, that is extra number of digits, can be seen. Brachydactyly, short digits, as well as asymmetry of limbs is present. Coming to evaluation, it is basically a clinical abnormalities. That whole marbling pattern is kind of characteristic for hypomelanosis of eye tone. We can do Woods lump to enhance the hypopigmentation, but in case of any neurological abnormalities, we have to do imaging in the form of CT or MRI, and they usually present with corpus callosum agenesis, local cerebral atrophy, diffuse cerebral atrophy, hemiatrophy, as well as cerebellar hypoplasia or atrophy. They can also be ventricular dilatation and vascular abnormalities, and sometimes rarely tumors can also be present. Then electroencephalogram should be done in cases of seizures, and skeletal radiography is needed in all cases. We have to also evaluate other systems such as the cardiac, genitourinary, as well as ophthalmological systems to detect any abnormalities. Coming to diagnostic criteria, we've got two major and two minor criteria. Major involves the cutaneous, the skin, the neurological and musculoskeletal systems, whereas minor criteria, it wants the presence of any chromosomal anomalies as well as other systems involvement. So in major, cutaneous hypopigmented linear streaks affecting more than two body segments present at birth or in the first month after birth. And the second criteria is presence of one or more neurological or musculoskeletal manifestations. In minor criteria, first is detection of chromosomal anomalies and aberrations, and the second criteria is presence of two or more congenital malformations excluding the central nervous and musculoskeletal systems. Coming to management, the treatment is entirely symptomatic. There is nothing to be done. There is no specific management. If skin lesions present with any additional symptoms such as photosensitivity or any pruritus or any other lesions, we have to treat them symptomatically. Special education is required, and because there is going to be CNS involvement as well as musculoskeletal involvement, so educating them regarding that, as well as anticonvulsants in cases of seizures are prescribed, and follow-up is necessary to monitor any complications, as well as genetic counseling is required. Thank you. Subscribe for more.